Hi friends, welcome to today's session on NABH 6th edition. It is AAC6. It is stating about laboratory services. Whatever the laboratory services are providing as per the scope of the services of the organization. So the objective elements are included: the scope of laboratory services, the infrastructure, the human resource, and the qualified trained staff should be there. Requisition, test, collection, identification, handling, for that SOP should be there. Laboratory results are available within a defined time frame. Critical results reporting, results are reported in a standardized manner, and there is a mechanism for the recall. And the laboratory test, whatever outsourced, that should be having the separate SOP. Let's see one by one. So scope of the laboratory services is commensurate to the services provided by the organization. So your lab scope should be based upon your organization scope of service. If your organization is providing cardiology, then your cardiac enzyme test should be available in your lab. If your organization is providing neurology, then neuro related all tests should be available in your lab. If your organization is providing diabetic is in your scope of service, then you should have the HbA1c, all the test in your lab. So it's based upon your scope of services. Whatever scope you are giving, as per that, whatever the test required, it should be available in your lab. And all the emergency test, it should be available in your lab, and your lab should function round the clock. Policies should be available for that. The infrastructure means the physical and equipments adequate to provide due to provide as per the defined scope of services. So whatever the scope of services you have, for that you should have the adequate equipment. Whatever the test you are having, for that you have the proper equipment. Your equipment inventory list should be there. Your lab layout plan should be there, like histopathology department, your biochemistry, your microbiology, your uh, all the histopathy department. So these are all department. There were specific space to be allocated for the department. Equipment should be allocated as per the department. Staff also should be allocated as per that. So all equipment should have annual maintenance contract or the CMC records. All the equipment should be calibrated as per the calibration calendar. So for all the equipment, you should have the calibration calendar, you should have the AMC CMC calendar, and the preventive maintenance. So all equipments, all the records should be available in the lab and should be updated as per the requirement. And whatever, wherever the requirement of statutory, it should be there. Like HIV testing, you should have take the consent, and also that should be available and that should be on place. So human resource is the adequate to provide the defined scope of services. Qualified trained personnel should be there. So approved manpower plan should be there with HR, with the department. And department wise staffing pattern should be decided, like biochemistry, how many staff should required, histopathology, how many, sample collection, how many, and your microbiology, what are the staff requirements. So like that your staff calculation should be done. HR files with qualification and registration, it should be there. All staff should be registered with their lab registration, and credentialing privileging should be there. For the doctors, it is required the credentialing privileging, and for the technician also, it is required the credentialing privileging. Training and competency assessment record also equally important for all the staff. So it should be there in their personal file. Requisition for test, collection, identification, handling, safe transportation, processing, and disposal of the specimen. These are the things should be written the SOP. So you should write one SOP policy for the lab, where you have to write what and all services you are providing, the test name, and how you will do the sample collection, how the transportation will happen from the collection to the lab, testing lab, then there how the it will be handled for the further processing of the test, then who will do the report releasing, how it will be done, how after the testing, what is the time duration you will keep the your specimen in your lab. So that also should be mentioned, and how you are going to discard it. So everything should be mentioned very clearly in your policy. So every test should be with requisition form, it should come. So standardized requisition form should be there. Whoever is sending the sample, they should write for what is the purpose of sending the sample and what is the clinical diagnosis of the patient. Then UHID should be there for all the samples. If UHID not, if the hospital wants to do the lab ID, then that also they can use it. But for the patient identification, some unique ID should be there. Biomedical waste management policies should be followed, and for the discarding the containers and the specimens and your tubes, blood tubes, and ETP should be connected to the lab sink. These are all the requirement of NABH. Your all lab sink where you are discarding your chemicals, your blood, body fluids and all, that should be connected to your ETP. Laboratory results are available within a defined time frame. For that, SOP should be there. For all the test, what is the TAT time should be defined in your SOP. As per the nature of test also, it should be defined the TAT. First you have to define the TAT for all the test. Then again, nature of test, like urgency, criticality requirement, that is like emergency requirement. So in that basis also TAT should be defined. So TAT should be displayed outside of the lab reception or the report collection counter or sample collection area, or you can display in the website also. Electronically you can display in the TV, but it should be displayed. That is mandatory. TAT should be displayed. Otherwise you will get the NABH NC. Critical result to be intimated to the person is earliest. This is a very important topic in the NABH in the lab. So policies should be there for the critical result reporting, and policies should include the all the requirement, like biological reference should be there for all the test. Critical value for the test should be defined. Critical value for the outsourced investigation also you have to define. It's not like that whatever test you are doing in-house, that critical only result only you will define. No, all the biological reference, whatever the test you are having, whatever you are doing, the outsource also should be there in your policy as written as this test is outsourced. But reference should be there, critical value should be there. So critical result should be intimated within 1 hour of the test done. So from the lab, one person will intimate to the treating doctor or nurse, and they should document it in a register. That register should have the column of the patient name, UHID, then who is intimating, what is the reference, like critical value, what is the critical value, test name, critical value. First will be your patient name, UHID, test name, critical value, then who is reporting, to whom is reporting, readback is done or not, what is the date of reporting, what is the time of reporting. So these are the things should be written in your critical register, otherwise that will be invalid. Results are reported in a standardized manner. Organizations should have a standardized format for reporting, which include organization name, patient name, UHID, reference range, and the name and signature of the reporting person. So one standardized format you can prepare in your LIS or HIS, where your organization name will be there, patient name, UHID. It should generate automatic, and the whatever the test is they have done for the test, the reference range should be shown. Either the value is high or low, the value side you can mark as high or low, or if any abnormal value has come, that should be highlighted. Name and signature reporting person should be there. In case of outsourced test, the outsourced lab name should be displayed in the report, or any reference number should be displayed in the report. There is a mechanism to address the recall or amendment of report wherever applicable. So SOP should be made on recall of the reports. How you will do the recall, who will do the recall, what and all needs to be done. So the SOP should be included, like any reports required the recall should be taken out from the all clinical area, LIS and HIS also. Wherever you are doing the recall of the report, that should be, you should call all the areas wherever you have dispensed the report, including the patient. If you have already dispatched to the patient also should be called for the return of that record and to take the new report. And if any clinical area you have already dispatched to the ward side or the emergency or OT or anywhere, then that should be recalled and you have to rectify all the things. If issue to the patient, then you have to recall and you have to give a fresh report with writing, I ignore the previous one. Ignore the previous one should be written in the report. Otherwise, patient will be confused with both the report. Incident needs to be raised on the same, corrective preventive action to be taken on and documented, and that should be reported to the quality department as a KPI, key performance indicator. SOP should be there for all the outsourced tests. Laboratories test whichever is not available in the organization, you are doing the outsource, there should be a written document on that. Quality assurance system should be followed. So SOP should be there for the all outsourced state. In your SOP, the list of tests should be mentioned, and MOU should be done. MOU also you have to include in your SOP. One copy you can just attach as an appendix. And the whoever the person is transporting the specimen from the lab to the outsourced center, and whoever is carrying the report, whoever is reporting the critical value, everything should be documented in the policy and MOU. In the MOU, one last page, you should have the quality assurance parameter. In the quality assurance parameter, these are the things should be written, like the person whoever is transporting the specimen and they are reporting should be done properly. Packaging, identification, requisition, labeling as per the requirement should be there. So these are the things should be mentioned very clearly in your MOU as a quality parameter. And organizations should inspect the lab at least once in 6 months. That how they are doing the test, what and all parameter they are following. So either the lab will be NABL, outsourced lab also, that is not a matter. But the lab should go from the hospital, from the lab, one person should go and do the inspection in that outsourced lab, and the report should be documented. Thank you so much. If any other concern, then please comment. If you like the channel, then like and please subscribe the channel for more informative videos. Thank you.